will you share to us the protocol that you use in your med spa? Sure. So, again, the protocol is pretty straightforward. And so if they're at risk of hyperpigmentation, as we discussed earlier, we'll put them on some product before. Other than that, I advise them no sun for 2 weeks before. We have them on a medical grade skincare line prior to coming in for their treatment. We bring them into practice, and they get topical numbing placed on their face, and they get that for 30 minutes. We use a compounded BLT, which is benzocaine, lidocaine, tetracaine. It's 20%, 10%, and 10%, and that gets applied for 30 minutes prior to their procedure. At that point, it is removed, and their face is cleansed with just a gentle wash that actually is going to remove all the oils because we want this to be dry. We then cleanse it with hypochlorous acid and before we start the treatment. And then we're going to use the devices you've seen on dry skin. So we don't put anything on that at all. We do the scratching. We try to put those very close to each other for a more aggressive treatment. Again, the further we spread those, boxes apart, the less aggressive the treatment, the quicker the healing. So we scratch over the entire face if we're doing a full face rejuvenation. If we're wanting to tighten a particular area more than others, we can basically make that grid pattern really tight in that area. So if I'm trying to really tighten back in around the jaw area, maybe I'm going to tightly cross-hatch that area. But in the general and mid face, if I just want some more of a skin glow, I can loosely cross-hatch those so that we can selectively determine how we're going to tighten that area. But the protocol is basically numb, cleanse, dry face application of this. And then the really, really important part is at the end, what you saw me putting on. And that is when we use our products. And so that I do use the ActoFeel line of products. The Acto Reverse is what I like to use for this. And so it's a product, it's a hyaluronic acid base that has a CD44 signaling molecule in it. So it's basically a signaling, it goes in there and signals the CD44 receptors to make collagen and elastin. So we're putting something in after we've done this semi-ablative treatment to signal that. I also send them home with that and with instructions that they're going to apply it again within about 2 hours of that procedure. And we give them a post-care kit, which is going to include, a line of products that addresses whatever their concerns are. So we have products that we have for texture, for pigment, but also in all of the product lines. And you can incorporate, I think the ActoFeel immediately afterwards and within 4 hours is really key to getting these results. So I would say that is a very important step in the protocol. What you do from that point forward, I think is important, but less so about a particular brand. And so we do have a brand of products at Med Results that you can use for really outstanding results. But if you're already carrying, elastin because you're a big, Galderma account or Zeo or one of those other product lines, I think make sure you know your product line. It's a great time for you to incorporate retail into your practice and make sure that they're using some sort of a gentle wash and sunscreen. That's going to be your keys to this.